All right, so you've had your spinal fusion, much like I have already in 2021. I had mine. And you are wondering, do I or do I not have my hardware removed? So that's the question we're going to talk about today. Now, for me personally, I still have my hardware in, and I have not been advised to have mine removed. But I can tell you, for instance, today, a thunderstorm came in, and within 10 minutes, my spinal fusion or something inside of there was stabbing me in the back. Is that my hardware? Is that my metal? Is that the screws? Is that the nerve damage I have? I don't know. But I can't tell you whether getting your hardware removed is the right thing or not. But what I can tell you is this, as I've said in many videos, please don't even consider a spinal fusion until it is your absolute last resort and you have no other options. And that means changing the parameters of your entire life before considering a spinal fusion. Because I will never be the same. Now, there's other extraneous factors involved with me, but my spinal fusion has changed my life in a way that I would pay millions to just go back and not have it done. But I was in a different place. I was at a point where I had to have mine done because I was bone on bone, as you'll see here in the scan. And I had chips of bone in between my vertebrae. And it was nonstop pain 24/7. But now here I am 4 years later, still in nonstop pain 24/7. It's just a different pain. So, but at least before, I was able to function in different ways, and I can't now. Now, here at Healing Together, a large portion of our community are here for the spinal fusion information and my feedback and my experience. And many of you have said it has been advised to you to have your hardware removed. Now, let's think about this for a second. First off, the doctors and surgeons and the medical system, they're getting paid to perform this surgery, getting paid very well to perform this surgery. You go through your spinal fusion surgery. It's completed. You take your 10 to 12 months to recover. Maybe you're doing well. Maybe you're doing a little better. And then they say, okay, come in and let's remove your hardware. Now here's the crapshoot. Am I going to continue getting better, or am I going to then get worse? Because I've experienced speaking with so many people in this community that I've had both. Once they have recovered from their spinal fusion and felt relief, getting their hardware removed has then made it worse. Whereas others, having the hardware removed has made it better. So sadly, there is no end-all be-all answer to this. Just like everything else, this is such an individual circumstance. But I'll repeat my words. Please, nobody, no one out there, even consider spinal fusion until you have tried everything else beforehand. Exercise, physical therapy, changing your lifestyle, changing your diet, changing your job, changing the way you sit, changing the way you stand, changing the way you sleep. Change everything you can. Change over to an anti-inflammatory diet. Do everything possible to avoid even having to get to the point of a spinal fusion. And that's what I tell my kids every day. Guys, I wouldn't wish this on anyone. This pain is horrific. There are days that I can get by and feel not so horrific, but for the most part, the pain in my legs, the pain in my back, the pain up my spine, down into my neck, I wouldn't wish it on anyone. And I've been through a lot of major pains in my life. I have a severe TBI from taking 600 pounds of steel directly to the skull. I've lost function of all my organs. I've been jumped, beaten, knifed, stabbed. I was a street fighter, trained progressive fighting systems for most of my life, boxed. I am no slouch to pain. But this nerve pain, this spinal pain, this non-stop stabbing me in the spine pain, non-stop pins and needles and just jabbing things in my legs all day long. And then when you lay down for relief, you get a few seconds of relief when you feel like the weight of the world just comes off of your body and your legs go, ah. And then the longer you lay there, on come the pins and needles. On come the numbness. On come the stabbing. Then on comes the pain. I don't know what to tell you. I wish I did. I wish I had an answer for this. I wish a lot of things, actually. But whether or not getting your hardware removed is right for you or not, it's a tough call. And only you can make that call. All right, friends. Catch you next video.